Okay, welcome to the Marina Hills Medical Moment. Today I want to talk about a diagnostic test we often do here at the office called cytology. Essentially what that means is we're collecting a sample from one of our patients, and specifically we're collecting individual cells. What's different between a cytology and a biopsy is the amount of material that we have to look at. Whenever we're doing a cytology, we have an individual layer of cells on a glass slide. And the difference is that with histopathology, we have a chunk of tissue, something that could float in a jar, that is processed. The major difference is in the case of cytology, we're looking at individual cells, and in the case of histopathology, we're looking at tissues. And there are certain things which can certainly be determined based on the individual cells through cytology. There's other times where the information is not so much the individual cells, but rather how they relate to one another. And in that situation, biopsy is required, particularly when we're looking at complex cancers and tumors. But cytology can easily be collected. That's one of the appeals. It's simply a matter of either using a glass slide and making an impression into debris that's on the surface of the skin, or using a needle to collect cells that are below the skin, either in the skin itself or sometimes even from within organs inside our pets. We can use our ultrasound unit to guide the collection of needle aspirates for cytology. The most common things that we find when we do cytology from ears, from an ear canal, is we may find bacteria, and those could be round bacteria, we call them cocci. It could be rod bacteria, those are the bad guys. It could be yeast, and the determination of which organisms we find helps direct us to what type of cleaners and what types of medications are needed. In the case of skin cytology, we're also looking for organisms, cocci, yeast, or bacteria, but very importantly, we're looking for white blood cells. And are those white blood cells intact, or are they working hard and being beat up? Because with infectious disease, they're often sad-looking, worn-out white blood cells. We call them streaming neutrophils. And in the case of autoimmune conditions, the white blood cells might be completely intact. And that would be significant because autoimmune conditions of the skin are treated very differently than infectious disease. And then just to make things interesting, there's a time where there is a parasite called Demodex, which is technically an infectious agent, though we don't always think of them that way, but they're accompanied by intact white blood cells. So we stay alert as we work through what we see and what it means when we do skin cytologies. When we do needle aspirates of masses, one of the major things we're looking for are round cell tumors, because round cell tumors reveal themselves quite nicely with a needle aspirate. Some round cell tumors are benign, like histiocytomas, and other round cell tumors are variable, like a mast cell tumor. There are some low-grade mast cell tumors that are a little concern, and there are some bad news mast cell tumors. Most of them are middle of the road. In the case of a mast cell tumor, removing the tumor for biopsy and histopathology is needed to know what grade. But the benefit is knowing if it's a mast cell tumor versus a histiocytoma. So that's a brief outline of where we often use cytology as a diagnostic tool here at the practice. If your pet needs medical care, see your local veterinarian, or if you're here in the Saddleback Valley, we'd be glad to care for your pet here at Marina Hills Animal Hospital.